The two Ebola cases in North Texas have raised many questions. That's our other big story. To help us answer them, we invited Dr. Darren D'Agostino. I'm going to say that right. D'Agostino from the University of North Texas Health Science Center. Thanks so much for joining us.
Thank you for having me.
You know, a lot of people have questions about Ebola. On our Facebook page, one person asked, is Ebola airborne? And we've kind of talked about that a lot on the news, but let's hear it from the medical professional.
Right. It's not airborne. This is what makes it more difficult to catch than the flu. The flu is actually much easier to catch than Ebola.
Which is comforting for a lot of people, I'm sure. You don't have to go around with a face mask on,
right.
Concerned about catching Ebola. But we have heard that it can be transferred by mucous membranes, eyes, nose, mouth. But can you catch it from sweat? People on Facebook asking, how do you get Ebola from sweat? Do you have to have it enter a mucous membrane, like shake somebody's sweaty hand and then rub your eye?
Right. Yes, you do. It would be, once the sweat is on your hands or touches your body, it would have to make it to a mucous membrane or a cut in the skin.
And if you don't have a cut in the skin, there's no way of catching it.
It makes it much more difficult.
Okay. And for those watching at home, perhaps they have children at Dallas ISD. They're concerned about these children that have been kept in isolation. But what is the #1 reason to calm fears right now for anybody who's concerned?
Right. It goes back to how you catch this. You have to be in contact with somebody who is demonstrating the symptoms and is not feeling well, has a large, what we call viral load, so a lot of copies of the virus in their blood. And once these kids, in this case, are isolated and we're past the time of infectious possibility, they're free to go back into the public without a problem.
All right, Dr. Darren D'Agostino.
D'Agostino.
Thanks so much for being with us.
Thank you.